For those who are on our call, if I can just have you go ahead and mute, if you haven't already, mute your microphone, turn off your video, and we'll use the chat feature today to do the Q&A. And so without any further delay, I'd like to welcome, first I'll say thank you all for joining the series. My apologies again for the rough start. This Ask the Expert series is part of a greater initiative from the partnership in helping businesses move forward into a reopening stage. We've put together some playbooks available for you for businesses and FAQs on other resources available at dsmpartnership.com/DSM-forward. And hopefully these resources will be valuable to you going forward. So I'd like to welcome today AJ Mum, Emergency Management Director with Polk County, and Li Zhao, President of China Iowa Group. Thank you both for joining us today. And I think what I'll do is go ahead and stop the share. And we've got the cameras up here, and if you I'd like to start out by maybe having each of you just kind of give us a perspective and of kind of what your role is in the whole PPE and safety space, and then a little bit of where do you see things today. So Lee, maybe we could start with you, kind of what's your role? How are you involved in all this process? And then where do you see things stand today?
Wonderful, thank you. I was not a PPE expert. As a matter of fact, I don't even know what PPE stands for prior to the pandemic. Our business, China Iowa Group, we are a import and export company based in Des Moines, Iowa. What we have been doing for the past decade is we have a team on the ground doing the quality control, where we do OEM manufacturing per our customers' request back in Iowa. And then we ship the products or the goods to Iowa, and then we distribute it to end users and customers. Right when the outbreaks start, I noticed there's a shortage of PPEs, and I did not jump into the PPE business because I thought it's against my conscience to be profit from a pandemic. So rather than getting into the business right away, we have refocused our business by trying to get as many donated PPE as possible. For example, with the coordination of the governor's office, we were able to secure over 100,000 masks be donated to the state of Iowa. And then I'm still working on a donation right now as we speak, trying to get a donation from our sister cities, Red Cross, to be donated to the city of Des Moines, including LifeServe, Every Step, some of those nonprofits that are hurt badly, that they don't have the proper PPE yet, and we're trying to get them the shipment. And about a month ago, I started to realize there's only so much I can do with donation. It's not sustainable. As we reopen our economy, as we reopen, business, we're going to need a lot more PPE. So we decided to use market as the most effective way to import large amount of PPE, because we already know the manufacturers. And that's what we do. And we have a team of people checking quality so we can be assured that this PPE meet the standards. If they require FDA registration or be a 510K certification, we can do that verification process. So that's what we've been doing for the past month. And how we see things right now is, at the beginning, there has been a lot of disruption and people are struggling to get PPEs. Right now, I would say it's getting much better. And we have seen a price decrease in a lot of the PPE. But looking ahead, as the second wave coming, and also with a new surge of cases in Beijing, Tokyo, and a couple Asian countries, we anticipate the price of PPE will go up just because people are still trying to stock up for the rest of the year. So, we recommend everybody, if you haven't stored enough PPE to last you through the year, I would strongly recommend you to do so now. Well, that's a nutshell, and I look forward to discuss more on PPE with everybody here today.
Okay, thank you, Lee. AJ, if I could ask you to talk a little bit about your role. You're very central to what's going on right now in many, many ways, but can you just kind of give us a background on what you do and kind of where things stand for you?
Sure, Mike, and thanks for having me. My name is AJ Mumm. I'm the Director of Emergency Management for Polk County, and represent a wonderful team, not only with the Emergency Management Agency, but everybody that works at the Emergency Operations Center. And the Emergency Operations Center is really a hub, and we've learned to do a lot more of our collaboration virtually because of this pandemic. But nonetheless, that whether it's a virtual or a physical hub, the Emergency Operations Center brings together the elected officials as a policy group. It brings together those that are in what we call the operations section. Those are the real, the doers, the subject matter experts. So the health department, we've got people from our communicable disease team with the Polk County Health Department. We've got hospitals, clinics, and emergency medical services represented. Community, Family, and Youth Services, which is a department within Polk County government that really focuses on the basic needs of individuals, just food, shelter, clothing, housing, those types of things. Of course, our emergency services, which are our more traditional partners within the fire department, the law enforcement, EMS, mental health is also represented. So a wide spectrum of people that are used to dealing with issues and problems, coming up with solutions together and delivering those solutions. But that also requires a planning section that's looking forward, either 24 hours ahead, 72 hours ahead, sometimes weeks and months ahead, as this pandemic is a little bit different than a tornado or a flood that we're used to dealing with in minutes, hours, and maybe days. This one is dealing with days, weeks, months, and possibly longer. But of course, the topic of this session here is on logistics. So logistics section is another one of our components of the Emergency Operations Center that's focused on identifying what that need is, finding resources to fill that need. Then it's the warehousing, the tracking, the inventorying, the distribution, so that the people in our finance and admin section that we ask to write the checks and pay for things have a justification that there's an operational need, that there's a logistical need, and that all of those match the objectives, the solution of what the problem we're trying to solve. So, just the credit goes to a number of diverse individuals and organizations that come together and solve problems.
Thank you. I appreciate that. So Lee, let's kind of dive in. I mean, I think when we think about PPE, personal protective equipment, we think about masks as probably one of the more visible ones. But can you kind of take us down through the kinds of different things beyond the mask and talk a little bit about what else, especially from a business perspective, what else is out there? What else should people be looking at and considering? I'm thinking, a lot of our very largest businesses have a lot of expertise in place, but when you look in the small and medium-sized businesses, not everybody knows, cleaning, wipes, all these different things. Can you kind of take us through the different products that are out there and how a small to medium business might utilize them?
Absolutely. Mask is the most effective one when it comes to preventing COVID-19. Everybody is already know that, and CDC, recommend everybody to wear a face mask. But some people might not know, although it's very comfortable to wear a cotton fabric mask, but if they only have 1 or 2 layers, and if there is not a filter in between those layers, they actually don't provide much protection at all when it comes to COVID-19, because the virus are just so small, and when the fabric are woven, they can go through the little holes, and then you're actually more susceptible in getting COVID because you have that false sense of security. So as a result, we recommend, if you must wear a cotton fabric mask, make sure to buy one that has a lot of layers. The more the layer, the better, or consider putting a disposable filters. Another option will be wearing those 3-ply, 3 layers, 3-ply disposable mask. It's less environmentally friendly, but it's very effective. This is especially useful for small business where they have to have a lot of customers or visitors that may or may not be wearing a mask, and then you can offer them on a one-time base. And then you have KN95 masks. These are the Chinese equivalent of N95 mask. They're supposed to be able to provide the same amount of filtration, which is 95%, and will be safer and more protection being offered with the KN95 mask. And they're more or less available in the market right now. And then we have the N95 NIOSH certified mask. These are the most sought after, and you don't see them in the market, and because they do have to go to the healthcare provider or first responder. And after that, we recommend face shields. Chances if you already get a COVID-19 test, you already seen the healthcare provider wearing the face shield. But for business, it's equally as important too, because once you only wear a mask, we know some of the the virus shit could be coming through your eyes as well. And unless you wear glasses, or if you don't, then you don't get that protection coming from face shield. But having said that, I want to mention, if you're wearing face shield, it does not replace the mask either, because you still could be breathing the air if you're just wearing a face shield, but it's much better than wearing nothing. So it's up to each business to evaluate the risk that you're in, the social distancing that you're able to maintain to make the right decision. Of course, the safest would be wearing the face shield plus a face mask. In some manufacturing setting, I know they're wearing a face shield and the goggles, and then on top of that, a face mask. And the goggle obviously offers other protection as well, because there could be some hazardous material coming, and the face shield cannot protect the workers from that. Outside of the things that you can wear, Mike, you mentioned about wipes. So alcohol wipes, sanitizing wipes are crucial in helping us to stay healthy. And I would recommend having as many of those in a lot of the accessible area in your premises to help protect your workers as well as your customers. Coming from other countries, for example, in China, there has been some new technologies that are being utilized in the PPE world. There are, for example, little LED lights. They're very portable like this. They're just a little bigger than your iPhone, and you can put your iPhone there and close the lid, and your iPhone will be sanitized in about 30 seconds. There are sanitizing robots, like for hotel lobby or for your storefront, where you can have someone constantly cleaning, then the robot will just doing their job and then just sanitizing. And you also have UV light. Some of those are, they're primarily for hospital, but some of them are commercial grade. They could be used for business. And then after that, you have temperature screening facilities or equipment. And I know John Deere, for example, they have very comprehensive one, but for smaller business, we're seeing in China that there is like a little, it's almost like a little screen of iPad. You look at the iPad and then it can automatically monitor all the temperature, and then the data will be stored in the background, the back end, so that it's touchless, but then everybody could be screened on a daily basis without anyone taking the temperature. So the example goes so on and so forth. And we're also seeing some new technology where they can capture and filter out the COVID-19 virus by putting some devices on top of the furnaces. As we can all know that COVID-19 virus does transmit it through the air condition too. And the list goes on and on, but then, we will definitely recommend face masks. That's number one for us to be safely open.
Great. Thanks very much. So Lee, we have one question in already for you. How about vinyl and nitrile gloves? I'm not sure if I said that right. Do you have regular access to these?
Yes, gloves is the hottest thing ever. We are an importer, so we work directly with manufacturers overseas. And I can tell you that the manufacturers of gloves in China sort of has already been taken over by the Chinese government. The supply is very limited. If we do see some, they're either stock from before, or some of them are not the super high quality ones. There are some manufacturing facility in Vietnam, Malaysia, and Thailand, but I know Medline, Top Gloves, those brands has already placed order in the billions, and they sort of already monopolize the supply. That's why you're seeing gloves price goes up as we speak every day. and it is very, very hard to get. We have regular access if it is large volume because we work directly with the manufacturers. For smaller volume, we can check to see if our warehouse in LA has any stock left.
Okay.
And also on the vinyl, yes, it's much more available than nitrile. Nitrile is the hot one right now.
Okay. AJ, if we could switch to you for a couple of these questions, and then we'll come back to some of the others. But we had the question, what do you do when you can't get your hands on the Clorox or alcohol wipes? Do you have any suggestions on other things, AJ, that works along those lines or alternatives for people?
Yeah, so the similar to hand sanitizer, there are alternatives like, you know, the old-fashioned soap and water washing of your hands can replace the it's a suitable alternative to the hand sanitizer. So just like wipes, they're the more traditional you know, bleach mixtures. Just an extreme caution there that always use those products according to the manufacturer's description, so that you know, we see a lot of people that are putting together dangerous concoctions of chemicals that aren't supposed to be mixed with one another, and that's more acutely dangerous than the virus itself. So follow the manufacturer's instructions on any of those products. But you know, a bleach solution, soap and water, those are still acceptable practices.
Yeah, and I want to just ask you a little bit more about that because there are good commercial, you know, retail grade cleaners that work quite well, from what I understand. Some of the name brand, you know, surface cleaners, the bathroom cleaners, those types of things are good cleaning products and represent, like you said, soap and water. I mean, those are still very viable and useful, are they not?
Right. And so, you know, a lot of those products will indicate the percentage of viruses in general that they are going to be effective on. And so, you know, read the small print. The information is there and available to you. Again, if you are an amateur, like I would consider myself, I'm going to, you know, read the label very carefully, but then also ask, you know, whoever does your normal sanitation and cleaning, is ask the manufacturer. A lot of times there'll be an 1-800 number on there. You can certainly call that number and ask if it's effective with the coronavirus. And you know, they by law they're required to tell you the level of effectiveness of their product.
We got another question here. Do portable air purifiers work, and are they recommended for smaller offices and businesses?
That one I don't know that that I can really answer with any confidence. Again, it's the I see a lot of people that are, you know, trying to do the best they can and come up with alternatives. I'd be very cautious about that. Again, consult the manufacturer, contact a professional in that area, because most, you know, air purifiers are going to have a filter. It's very similar to the discussion that Lee was having on the mask. It's a lot of it is depending upon the density of the fibers and the size of the particle that it's designed to stop. And so there are going to be a variety of filters on air purifiers that may be perfectly acceptable for dust mites and, you know, lint and other, you know, just carpet fibers and stuff that are in the air, but may not be effective for coronavirus based on the size of the virus and the particle that it's usually attached to, like a droplet of saliva or vapor.
We've got another question here. It says, has any, oh, go ahead, Lee, did you have something to add?
Oh, I would just echo what AJ has mentioned on you have to really check on that product. I do know in China, a lot of businesses use that and it's proven to be effective, but without looking at it, we cannot advise what it is and how it's being used. But I would recommend HEPA filter if you could install it, and that's something that, you know, is proven to have to be, you know, very effective too.
Okay, great. The next question has to do with ozone generators. The question says, has anyone looked at the possibility of using ozone generators to disinfect ambulances, hospitals, et cetera, after use? Obviously, while people are not in the area. Do either one of you have anything to add to that?
I can tell you that I don't know specifically about ozone, but a couple different methods to disinfect ambulances specifically, and they're actually used in combination. And one is an aerosolizing disinfectant sprayer that is usually takes about 20 to 30 minutes, 45 minutes of time to be effective, but they use that in conjunction with a UV light. And so those two are used effectively in conjunction with one another. So a combination of a disinfectant spray and UV light, but I don't know specifically about ozone.
Yeah, me neither. And so
well, I think
same as what AJ said. Yeah. Mm-hmm.
Yeah, it represents a challenge. We have so many pieces of information coming at us from so many channels that I'm glad you both are here because it's important to say what we don't know is what we do. The next question is, what are good products to use to disinfect electronics like computers, keyboards, etc.?
So, you know, it goes back to the wipes. I think the wipes are the best, but sometimes they're going to be limited supply. So again, look at the manufacturer's instructions. A lot of times there needs to be a period of time and an amount of the solution that actually sits on the keyboard. So a quick, you know, light spray of Lysol and then a quick wipe off with a dry rag may not saturate enough, and it may not sit on the surface long enough to be effective. So a lot of times it's not the product, but it's the use of the product that really needs to be carefully applied.
Lee?
Yes. Definitely alcohol wipes and other wipes. Mm-hmm.
And the alcohol, thank you, Lee, for bringing that up. The alcohol solution is recommended to be greater than 60%. So usually an 80% solution is what you should be looking for. There are a number of hand sanitizers that are on the market. If you read the small print, it'll be a alcohol percentage below 60%. And then by its nature, it's not going to be effective on the coronavirus or as effective.
Yeah.
Mm-hmm. And I'm glad AJ brought that up. And then people start getting into a misconception that the higher the percentage of the alcohol, the better it is. It's not like that either, because once it's beyond 80 or 90%, actually became too strong that it actually doesn't dissolve the surface of the you know, remember the spike of the coronavirus? When it's too high, you know, it doesn't kill the coronavirus either. So 70 to 80% is probably the sweet spot, and you'd be looking for, we always look for 75% as like the most effective percentage.
So as the old adage says, more is not always better.
True.
Correct, yes.
Yeah. If a product says it kills a percentage of bacteria, does that mean it will also kill the same amount of viruses?
No, I'm not a microbiologist, but I'm pretty sure that would those do not equate. So again, check the small print. Just the makeup of a virus is much different than that of bacteria, and so one does not always substitute the other. And so again, consult the manufacturer of the product.
Let's go back to face coverings. I'd like to talk to you both about you know, what kinds of policies are you seeing as businesses open with regard to face masks, first with employees and then also with visitors? I'd sure like to hear both of your thoughts on, we understand more is better on the mask, the better the mask and all that, but what kind of policies are you hearing about? Lee, maybe you'd like to start?
Yes, we're hearing right now it's all over the place because there haven't been a federal mandate coming out to give guidelines in terms of what employers should be doing. You have a lot of companies that are very cautious, and they will require all of their employees and visitors to wear a mask. And then all the way to some employers, they just say it's, you know, do as you please, and or some of them encouraging them from the mask, and all over the place. But what we believe would be a good policy is definitely to encourage people to wear a mask. Yes, we understand it's, you know, making people a little uncomfortable, but they will get used to it after a day or two, because All it takes is one asymptomatic person, whether it's your coworkers or a visitor, spread the virus, and everybody is at risk. The loss from the productivity in that alone is going to be much, much more, than getting yourself the proper mask and proper PPE and the extra, hassle of having everybody put it on. And if you look at the data coming from Asian countries versus right now, Americas and Europe, they have a much effective rate of curbing, bend the curve, right? And most experts and scientists have attributed to the mask culture because Asian countries are very used to the idea of wearing masks. As a matter of fact, they wear it whether there's COVID-19 or not, right? Because there's the dust mask, there's the dust, there's the pollution, and some of the Asian people think wearing masks is fashionable. You don't have to put your makeup on, right? And if you don't want to smile, you don't have to. So there are many benefits of wearing masks. And that's why they've been having much more success in preventing the spread of COVID than we have. But I'm so glad that everybody now sort of on the same page on mask. And if we really do it now and adopt the mask culture, we can actually have a shorter duration of COVID-19 and we will get back to our normal life faster. But it takes a group effort. And one thing that I always tell my friends who are reluctant to put on masks is, do you have any trouble or hesitation to put on the sunglasses? They're like, no, why? I said, it's the same thing. We Asian countries do not have a sunglasses culture. So at the beginning, people think of wearing sunglasses, you're either a Hollywood star or you are a gang member, right? But as a result, the people are not getting the protection and they're getting more UV damage in their eyes. But later they realize, okay, wearing sunglasses, I'm not trying to put on a statement, I'm simply trying to protect my eyesight. And now people are very they're much more comfortable putting on sunglasses, and you see everybody wear sunglasses. And coming back here, I expected the same thing, yes, the mask is not going to take away your freedom, but rather protecting you and protecting others. It's just, it's even an extra bonus is than wearing sunglasses. If you don't have any trouble wearing sunglasses, and it's the same concept, you shouldn't have any trouble wearing a mask.
All right. AJ, your thoughts?
So I think the most common recommendation is that certainly in common areas of a traditional office environment, the common areas that masks should be worn. There's if you have your own office with 4 walls and a ceiling, probably not as important that you wear the mask in your own office. But if you go out into a corridor, a break room, a cafeteria, that you should try to don that mask as much as possible. And so a lot of the places that have sort of the cubicle, environment that where you have maybe 3.5 walls, but an open environment up above with airflow commonly exchanged, you probably should be wearing your mask.
Yeah. The next question we have here is, oh, go ahead. Do you want to add something?
Yes, and for those not-for-profit or small business, they haven't have masks yet. That was the reason why if they don't have masks, they couldn't wear it yet. Please reach out to me. We are donating a small amount of masks to nonprofits and small business to hold you over before you can get your mask. Just contact me and we're donating masks for small business and nonprofit.
And for everybody on the call today, I will, right after the call's over, I'll send out Lee and AJ, if you'd like your contact information. If people have questions, they can reach out. We'll go with that. And thank you for doing that. We really appreciate it. The next question comes in. We're going to need a chemist here. There's a chemical called dimethyl aluminum. Oh boy, I don't even know what that is. Chloride, aluminum chloride, I think. Is it effective on viruses?
I'm not qualified to answer that one. I'm sorry.
No, I'm not. Okay. Sorry,
yeah,
we should have brought a chemist along here. Is there a place, that's not being silly, it's just this is tough stuff. These are very challenging things. Is there a place where we can get information / flyers to share with employees on how to wear a mask, how to care for a mask, washing, etc., how to clean and how often to clean items like face shields. We're putting together packets of information for each employee with masks, sanitizers, cleaning products for their personal workspace, and we want to include information on proper cleaning. Great question.
Absolutely. So there's information, and I'm just going to give you a variety of sources. They're all going to be generally aligned with each other in terms of the content. The style and format that which they say the same thing may be a little bit different, but the CDC has information, the Iowa Department of Public Health, the Polk County Health Department, and an organization called Safeguard Iowa Partnership. All of them have put out information that I've seen directly on the proper wearing of face masks. A lot of times, people will properly apply their face mask, but then throughout the day, they're constantly touching the exterior of it, moving it around, and sadly, that defeats a lot of the purpose of the mask itself. So properly, what we call doffing or taking off the mask is just as important as properly wearing it throughout the day. So it's not just about putting it on, it's putting it on properly, not messing with it, not touching the exterior of the mask. The face shield, what it does is it discourages you from rubbing your eyes, scratching your nose, things like that. Take a look at CDC, Iowa Department of Public Health, the Polk County Health Department, if you're here in Polk County, as well as Safeguard Iowa Partnership. They all have great sources in infograms. I think it's the right term as I'm learning some of this 21st century ways to display information. Infograms that I think are very, very effective in showing pictorially how to do that properly.
And I'll send out links to those as well after the fact. That's a lot of good resources there. All right.
Yeah.
Lee, did you have more to add? Sorry.
No, Adrian covered it all.
Okay, great. We see a lot of people going through this process of saying, how many people should we bring back in? When should we bring our people back in? How much longer should we work remotely? Should we look at these changes on just a short-term basis? Should we look at these changes on a longer-term basis? AJ, you talked, in fact, Lee, I think you talked a little bit about second wave, and a lot of us are hearing words about that. Maybe you both can comment on this how do we look at this long-term? And my idea of long-term is a year or two, right? It's the foreseeable near future.
Well, then it's definitely long-term, before we have a vaccine or a effective treatment, we probably, and unfortunately, this will be the new normal that we have to abide by. And I also hear a lot of business and individual that even after life return to normal, they like where they are too. Just because by working virtually and remotely, they save a lot of time, they're more efficient, and save a lot of traveling costs. So there's some truth to that too. And then also it stimulate a variety of technology that help people strengthen their communication and make them more productive. So I suspect when COVID-19 completely disappears, it will not be a 100% back to normal. It will be somewhat of a hybrid, right? That people who like the new style might continue with the new style. The people who miss the old style, they want to go back to the old style. But either way, I foresee this will be a hybrid model, in which there's no good or bad. It's just how we evolve and how we progress as a human society. And maybe, who knows, we don't want it ever, but 20 years or 40 years down the road, we might have another pandemic too. So it's just that helping us getting more and more ready each time when we humans have to be tested for a challenge like that. And we must make sure that we're nimble enough to take on those challenges.
Makes sense. AJ?
Yeah, I think that it will be a hybrid. Our public health experts, the epidemiologists, talk about the terms herd immunity. And until we reach that, or that there is a vaccine, as Lee mentioned, this is our new normal. I think that term gets overused, but it's very descriptive. And that's just the world we're going to live in, that hybrid world. I think it's it's sort of a balance between productivity and the social distancing, the PPE available. There's a variety of variables at play here. And so everybody's going to find themselves in a little bit different situation. And so, if you're able to have the majority of your workforce work remotely, that's great. But what are they doing when they leave their home office, and what are they doing when they go into the grocery store? And so there's just so many variables that it really takes some compliance, some voluntary compliance on all of our parts to do the right thing, to do those mitigation activities, to try to reach that peak productivity. And every disaster has led to innovations, and there is that silver lining, and there will be innovations with this pandemic as well.
Yeah.
Mm-hmm. Yeah.
Both of your thoughts on non-essential visitors to the workplace. We think about our workplaces. It used to be very, very social. People come in, bring their kids in. I mean, we're social beings, right? But how should we be looking at the non-essential visitors?
The way I think about this one is, the physical security environment after 9/11, that changed a lot of the ways that we, access a routine flight from Des Moines to Chicago, for example. It's changed the way that we go to a large event, that there are screenings. It's changed the way, just not necessarily from 9/11, but from active shooter situations, that it's changed the way that we go to concerts. So, I think that this will also change the way that our workplaces are dealt with from a health standpoint as well. So where 9/11 and the active shooters that we've seen across the country and our world, they've changed our physical security posture. And I think this also changes our physical health posture.
Yeah, definitely. And if they're non-essential, we should try to encourage the visitors not be visiting the business not yet. If they must come, and having the visitors stay in maybe the atrium, or just kind of limit that visitors moving around the business is a good idea, so that in case there's something, then at least it's been controlled.
I'll give you, Mike, if I can add one more thing that I thought about, which may be a little bit obscure for some people, but at many of the correctional institutions, and the Polk County Jail is an example of this, and this is pre-COVID, pre-coronavirus, that the way that the inmate visitation would traditionally take place, that they would move an inmate out of their cell or out of a pod. They would bring him to a location, and there would be that interaction, that we've all seen on the movies, through a plexiglass or security glass. Well, the way that's done for the last several years is that they move a electronic, basically an iPad, or what we might look at as FaceTime kind of environment. They'll move that into the pod to allow the inmate to converse with their family members from wherever they're at home, at work, or wherever. And so that was initially done to save time and the safety of the inmate and the detention officers, but it's an innovation that applies here in our world. And so having those ways of visitors interacting with those in the workplace over a tool like we're on right here is probably the wave of the future.
Yeah.
Mm-hmm.
We had another question come in. Should we be doing anything with deliveries, such as not touching boxes for a period of time, or wiping them down before opening? Great question.
I mean, experts definitely are split on this one. Some experts says even if the virus can survive on surface, they're probably not concentrated enough to cause infection. Other experts do warn that, since there is the possibility of them being there, and then if you don't wash your hand right away and you touch yourself, then you might be at risk of getting them. My personal rule of thumb is I open the package after 24 hours. then the chances are much, much, much smaller. And then I always wash my hands afterwards. I do wipe down some grocery items just because we're eating it, right, you know, like the package of the food, I just wipe it really quick with the alcohol wipes. For fruits, I wash them, and you know, those are just good hygiene anyway. I wash my fruit before there's COVID-19, and then knowing that I do this, and then that gives me a peace of mind, and I don't have to suspect that I might get COVID because I ate unwashed fruit or something, and that's, I think that's worth it, the extra effort.
Yeah, I would agree.
Yeah, it's interesting because I've been interviewing a lot of people through this series we've been doing, and I talked to two of the medical directors of the local hospitals, and you know, I think it's frustrating for some people, but it comes down to it, washing your hands regularly and wearing a mask are paramount. They really are. Well, we've come to kind of the end of the questions. I guess what I would ask is if each one of you can just give any closing thoughts you have before we wrap this up. AJ, maybe we can start with you and just thoughts for people going forward with these businesses as a closing comment.
Yeah, so first of all, thanks for having me. Always enjoy these. I learn just as much on this end of it as I do as a participant. So I always enjoy these. I would say our recommendation is secure your own supply chain. I think one of the things that this pandemic exposed is the vulnerability and the reliance on just-in-time products, whether that's PPE or it's you know, a nice cut of steak at the grocery store. That we live in this just-in-time delivery, and those just-in-time deliveries 99.9% of the time serve us extremely well and are very convenient for us, but they can also be, you know, vulnerable to disruptions. And when that disruption occurs and we're unprepared, that means that we're going to have to seek an alternative, or we're going to have to do without. And just to encourage everybody to look at their own supply chains, establish a library or a catalog of providers so that you can build your own resiliency to those disruptions. The things that we're, you know, encouraging folks to look at is again, multiple providers. Make sure that the products that you are seeking, you're not doing panic buying, because when we do panic buying, sometimes we're not doing our due diligence. Lee talked about looking at the certification of the products and the registration of the vendor, and being suspicious about, you know, pay 100% upfront with no guaranteed delivery time. Those types of things are going to, you know, sometimes buyer beware. And so do your due diligence, do your research. There's, you know, a lot of those, the hospitals and clinics that had a single vendor and a single contract. What it required them to do is to make sure that they have depth on their bench, so to speak. And that's come back slowly. And Lee covered that very well at the beginning, is that, you know, we're starting to get back into a more reliable supply chain, but it's still not 100%. So that's homework we can all do.
Yeah. Well, Lee,
Yeah.
before you give your final comment, we had one more question, and I think it's a good one. Do KN95 masks expire?
Yes. KN95 mask supposedly is the equivalent, the Chinese equivalent of our AN95 mask. And OSHA, the certification body for N95 NIOSH mask, recommended they should use no more than 48 hours. What it does is, you know, every time we breathe in and breathe out, there is a certain amount of moisture, and those moisture, as you know, time accumulates, will kind of decrease the effectiveness of all the fibers that are layered. And then, you know, eventually, even after repeated sanitization, you know, I know people, some of them put it under the sun or UV light, and those help to disinfect the product, but they do not help to repair the decrease in the effectiveness of the fibers. Yeah, just kind of a rule of thumb. Added the hours. If you only use 1 hour or 2 per day, then you can kind of, you know, use it for longer. But if you use like a full 8 hours work day, then probably don't use it more than 3 or 4 days. Otherwise, again, it gives you a false sense of security where you're not getting the protection that you're getting. And then I must caution on the KN95 mask itself too. You know, what happened was with Chinese manufacturers, a lot of them, they're not mass manufactured to begin with. And there's a lot of tricks and skill that's required to produce a qualified, you know, a high quality mask. And we have seen a lot of mask producer that produce the KN95 only offers less than 20% of the protection, which is a lot worse, you know, than what you can come up with your own fabric mask. And we strongly advise you, when you're buying KN95 masks from the internet, really try to find their certification. Look if they are FDA registered, and also try to buy those that are on the CDC white, they call it the whitelisted manufacturer. There's currently 31 manufacturers that are on the list. And technically, if you are buying it on the civilian or commercial market, they are not, you know, the CDC doesn't have a guideline for those. So you're just kind of buyer be aware, you know, you're buying on your risk, your own risk. And I also understand that for anyone who are looking for extra protection than just from a 3-ply mask, when you cannot buy N95 NIOSH mask, and your second best option is KN95. So just make sure you're buying the right one that are on the list. Otherwise, please just wear 2 3-ply masks. You know, that gives you 6 layers, and you will come as close to the same protection level as the KN95 mask would have given you.
Yeah, I think one of the questions may have been implied there is, what's the shelf life? So if I buy a box of KN95 masks, how long are those masks good before they just can't be used?
Usually 2 years. The manufacturer should put the expiration date on the box.
Okay.
Yep, there is an expiration date on the box, and we had many boxes across the Des Moines metro area, you know, that people were pulling off and saying, "Can I still use it?" When we ask the manufacturers, a lot of times the first thing that fails on those is the elasticity in the headband, and so then the mask doesn't fit as securely, which reduces its effectiveness. So it's not necessarily, you know, the mask, the cup itself. It's usually the headband that loses elasticity and reduces the effectiveness. So there is a shelf life, and there is a expiration date on the box.
All right, Lee, your last thoughts.
Yes, well, thank you for having me. It's a pleasure to be here sharing with everybody. And also I learned a ton from AJ and Mike and from everybody's question as well. I definitely echo what AJ said, build up a very diverse and resilient supply chain, suppliers list. And I also want to repeat what I shared earlier at the beginning of the meeting, that right now we have seen PPE supply being the best that it has been since the outbreak, and the price of most of PPE items has come down quite a bit. And it is the time to really stock up. And especially if you're, you know, a school, right? You don't have an immediate need right now, but you will need it at the end of August. I will not wait till the beginning of August to do it. I will do it right now, so that you're taking advantage of the low PPE price, the ample supply, and then you're all set for the year. And for other businesses too, you know, if you have the extra cash at hand, it's really the best opportunity to buy PPE and stock them up. We will anticipate with the second wave. First, the healthcare system will be using PPE faster, and then that will gradually dry up the PPE which is available to commercial setting too.
All right. Well, I want to thank you both so much for joining us today. I learned a lot as well, and I think we're going to continue to learn. The resources you both provided, we'll be getting that information out to the attendees list here right after the meeting. And again, I just want to say thank you to all our attendees. Remind them about our website area, dsmpartnership.com/DSM forward. There's a series of sets of information out there for you. So with that, thank you all, and we'll end the call.